Good afternoon, everyone, and a very warm welcome to our event today. I'm Alison Chong, and I'm just going to do a few words of introduction, and hopefully you will find today's event stimulating and you'll get some real enthusiasm from our speakers today. So, introduction to myself. I'm Alison Chong, I'm a director in AGEM, and I'm responsible for developing services that help enable integrated care. I'm passionate about integration and collaboration and the opportunity of creating strong public services, and I have strong public service values. I think all of us have joined this session today because we share these values and want to make a difference. And I know you will definitely want to get as much out of this event as possible. And it's a great time to reimagine what we can achieve together. We've got very significant challenges in our health and care system and in the wider economy. And we need to face those together, and we need to take a population and a very collaborative system-based way of thinking to those challenges. And the leadership of our new partnerships in integrated systems is a real opportunity for us to improve well-being as well as the health outcomes. Obviously, look at how we can address inequalities in access to care and quality of care, and also address those long-term efficiency and sustainability challenges. So I think we've got some real leverage here, that we've got a real moment where we can reimagine this opportunity we have in front of us, really, to have an impact as partners, lead this agenda with a new supportive network that we're launching today, which Becky will talk about. And I hope you will get a huge amount from that. And we want to model the best practice social value behaviours and ways of working. And our speakers today hopefully will enthuse you, provide a taster of the opportunity that's in front of us and the support that we've got to offer you. We're going to hear about how we can create sustainability and net zero from Alastair in a moment. We're going to look at co-production solutions where we've got genuine social innovation. And we're going to understand what the opportunity is for us as anchor institutions and how we can fully mobilise our community assets and voluntary sector in partnership. And most of all, how we can best use all our resources for the good of our population and communities we serve. So that's it from me. I'll help facilitate as we go along, but just let me introduce our first speaker, who's Alastair Clay. He leads the sustainable procurement team for NHS England. So if I can hand over to you, Alastair, thank you.
Thanks a lot. So I'm Alastair Clay, so I'm the Sustainable Procurement Manager within NHS England and the social value lead nationally as well at the moment within NHS England. So I'm going to talk to you briefly today for the next 10 minutes about obviously why social value is important, why it's important from an emissions perspective, how we can use it, and what support is available currently, before we evolve this great initiative in effect. So why in essence do we keep banging on about sustainability in the NHS, or why does anyone talk about sustainability? As you can see on the slide, sustainability is a health emergency. The climate emergency is a health emergency, sorry. The NHS is one of the biggest emitters because of its spend, its profile, its locations, its reach, it's anchored, it's anchored in every community. So it's a real contributor to emissions and a real contributor to environmental impacts nationally. So we've got to think about, why we're on this journey of social value, because we can better a lot of the things that we see on the screen in front of us. We talk about getting more severe weather and the impacts that has, air pollution. The NHS is big emitters of air pollution within it, because of its size and its scope of delivery. We talk about, the increasing allergens, water impact. These things can be addressed by social value, but I just wanted, before I start to go into social value, to just remind everybody on this call why we talk about social value and why it can be utilised, and why we talk about sustainability in the NHS, and why anybody talks about it. Next slide, please. So for those who recognise this, will recognise it from the Delivering a Net Zero NHS report that the Greener NHS wrote a few years ago now. But what this is a good representation of is, within the NHS, 62% of emissions, so basically anything blue on this diagram, 62% of all its NHS emissions come from the supply chain. And obviously, we all have a choice to contribute to lowering that, whether or not we work in procurement or not. and social value can be a key lever for that as we drive environmental change. But I just wanted to show the slide to showcase, okay, through procurement as a lever, which is obviously how social value is embedded, we can make a real change to this emission because it's the biggest emissions contributor within the NHS, or NHS Footprint Plus as it's called. And you know, our aim is to get to net zero by 2045. To do that, we have to bring the supply chain on the journey with us. We have to bring the services we offer. How do we do that? Through social value, first and foremost. You know, social value is an environmental model as well as social and economic, but we tend to focus in the first instance in the NHS through our national position. We want you to think environmental because of looking at this slide and the role you can play in that. Next slide, please, Cash. So some of you may or may not recognise this. This is our net zero supplier roadmap. This is what's mandated in NHS England, across NHS England through all the procurements that you do in terms of now and in the future. The only one I'm going to focus on is the very top box, which is obviously highlighted in a green, similar green to what you can see on the left. So this is just a reminder for everyone, if your NHS colleagues on this call, social value is an absolute must. It's mandatory within all procurements by the 10% weighting at minimum of the overall tender. We've got, as you'll show in the next slides, we've got guidance. We focus on PPNO 620. I'm not saying you have to do PPNO 620 because you've all got the remit of your choice, but obviously we suggest nationally in NHS England that you view social value, you deploy it, you define it, you contract manage it through the eyes and the lens of PPNO 620. But this is just a reminder for everyone in the NHS that, as it should be, social value is mandatory, because we all believe on this call, all the presenters, of the role it can play, of the scope of change it can deliver, of the good it can deliver, social value, both environmentally, socially and economically. Next slide, please. So what guidance is available currently, and if you were looking for that support, outside of the support, the more bespoke support that this group will give you, is obviously on the left hand side. You should all recognise PPNO 620, the social value model. On the right hand side is our healthcare furthering of that, which is the net zero and social value guidance. And this has obviously been created as a furthering of PPNO 620 to encourage you to seek healthcare related social value, be it again in the environment, socially or economically. Next slide, please. So on the left hand side, for those who do or don't know, we have what's called a CCF hub, because I sit as part of the central commercial function. On there is a wealth of support that's already available, which obviously isn't going to change no matter how this group evolves, but I just wanted to highlight that there is a lot of things that are available already for you to access should you need that support, such as tools on contract management, buying guides, if you wanted a bit more applicable support for things like transport, things like IT and hardware, that kind of stuff. There's a way in which we can all start talking about, I know some of the presenters might cover it later, how can we pair social value with the wider determinants of health and health inequalities to really make a difference and understand that? That's a real opportunity for this group. And there's training available there as well. So I'd urge you all, if you're not registered there, to register, or to make sure you're viewing there. And obviously, and also in Atomis, which is obviously how the NHS is basically keeping tabs on procurement through its system, there is the social value envelope in there, which we want people to be using when they're doing their procurements, which is obviously outside the scope of this group. This is more the admin of doing procurements. We want to make sure that that's used correctly. So there's a reminder for everyone who's NHS on this call to make sure you're utilising that. And I believe if I go to my next slide, it's a thank you from me. So there's a load of links there. There's a load of stuff that may be of interest. The bottom email that you can see there is our team's email address. Should you want to email us or get in touch, that'll come. Well, it'll probably be forwarded to me if it's social value. So do get in touch. If you wanted to access the CCF hub, the email at the top of the screen is the best place to email to do that. We obviously have to be an NHS colleague to do that. And that's it from me. I believe I'm handing over to Shelley now. Thank you very much.
I could just ask a question on.
Sorry.
I was just going to ask a question just of Alastair before he disappeared, Shelley, if that's okay.
Okay.
Just in terms of, there was a lot of technical guidance there, Alastair, but in terms of the key messages you want to get across this audience, what's the biggest opportunity you see? Because you've been at this for quite a while, leading this charge on behalf of the NHS around sustainability, net zero, how can we get procurement into the right place, really? So if you were to say, look, there's these 3 things to focus on that are going to make the biggest impact what would
Yeah.
you say they are? Just leave us with that message. That would be
Sure.
fantastic. Thanks.
So the first thing is obviously review guidance that's already available, because there's an element of we've done your jobs for you in terms of the defining and helping applying it. There's questions already there, so review guidance that's already available. I think proactively look at your pipeline of procurements to understand what's coming up. You know, what kind of social value can you be starting to think about? And my third thing is to don't just apply social value in the short term. Okay, I've got a procurement doing, what do I need to do? Think about the strategy, think about your local area, think about where the opportunity lies, think about, you know, who needs the benefit, think about those wider determinants of health, and talk to stakeholders within your community as well. That's what social value should be, is all about collective benefit. It's all about understanding where the change is needed or where the opportunity is, and targeting it if relevant through the procurement. So those probably be my 3 things that I would suggest.
Thanks very much. I know questions will be coming up through the chat bar in a minute, so if you can hang on and answer some of those. And I'm really looking forward to hearing from Shelley Brough, who's the Director of Integrated Commissioning for Cheshire East Council. And I've had a sneak preview of her slides, and they're really fabulous. Over to you, Shelley.
Thank you. So yes, Shelley Brough, I'm Acting Director of Commissioning at Cheshire East Council. Just a bit of my background. So I have worked within the voluntary community-based social enterprise sector. I've got a background in public health, and currently my role and remit within Cheshire East Council, my team are responsible for commissioning adult social care services, children's, public health, and I also am very, very lucky to have a communities team within my team as well. So some of the types of services that we would commission include domiciliary care services, sexual health, substance misuse services, for example. Next slide, please. So I really wanted to talk about co-production from a couple of perspectives. So first of all, in terms of co-producing your local approach to social value, but also how you embed co-production within your social value approach. So I think what's really important is to understand that to deliver effective and to maximise social value, to increase outcomes, have an impact within your communities. So co-production is really key, and co-production is a core principle of delivering and embedding social value approaches and practice within any organisation. So for me, putting that simply, co-production is about doing with and not doing to people. It can be quite uncomfortable for individuals and organisations, because one of the core principles of co-production is about creating equity and ensuring a balance of power across organisations, individuals, sectors and communities. It's about creating and ensuring that you're inclusive to your approach. It's about making sure that your co-production approach is accessible. So simply producing an online survey wouldn't cut it. It's about having conversations with people. It's about getting out and really capturing and working, co-designing services, your social value outcomes with individuals and communities. I'm really lucky because I have got a communities team embedded within my team who support my commissioners to go out and have those conversations. So they're physically out there within the community, talking to local residents and individuals within libraries, within coffee groups, within service user groups. It's also important to recognise that co-production needs to be mutually beneficial. And co-production done right can really make a difference in terms of achieving improved outcomes for people, residents and communities. Next slide, please. So the approach that you take to social value matters, and for me, making sure that co-production is embedded within your approach is key. So evidence shows that your approach is really important. It's about, it influences the scope and outcomes of your social value work. So starting with what social value means to you, your organisation, will help to facilitate local organisational buy-in or with your partners. It's really key to make sure that you have enthusiasm and drive, and that can be achieved through co-production, taking a strength-based approach with people and communities. It's important to get the right people in the room, basically. So it's not just about your own individual teams. So it's not just about your procurement teams working in isolation, or finance or commissioners working in isolation. It's about getting buy-in across the organisation with your partners, making sure that you're working effectively with the voluntary community faith, social enterprise sector, with local authority partners, with business and industry, residents and communities as well. Next slide, please. So Mark, who was one of the talkers within the session today, when we developed and co-produced our approach, we really recognised that we needed to go out to our communities, and this was the approach that Mark and his team within Wellbeing CIC took in terms of leading our co-production, leading our social value approach from a bottoms up grassroots communities perspective. So we really wanted to talk to our residents and our communities about what is important to you, what does good look like, what is basically a recipe for a good life. And some of the examples that local people spoke about, for example, was the importance of employment, developing skills, and a lot of that was about connecting with people within their community. So to underpin and develop your approach, it's key to take that co-production approach moving forward. Local outcomes need to be driven by local people, and that will help you to maximise effective social value. Next slide, please. So the work that we did across Cheshire and Merseyside, I've worked with Dave, Becky and Mark for a number of years now in terms of developing and improving our approach to social value. We wanted to make sure that we had some core principles that we would adhere to, and to give some guidance to local organisations. And from my perspective, for Cheshire East Council, the reason and rationale for me being involved for my organisation, I knew that we needed to improve and to get better in terms of how we develop and deliver social value. And the starting point was to understand what our core principles need to be. Next slide, please. And this is really where some of the recipe for a good life work came from, and the starting point for co-production, because we knew that some of our core principles were, so for example, it's about taking an assets, capabilities, strengths-based approach with our communities. It's about working across sectors. It's about giving local communities a voice. And these were some of the important key principles that we needed to develop to embed within our own organisations if we wanted to be successful in terms of developing social value. Next slide, please. Again, just to follow up on some of the additional principles that we identified, and this is something that really Mark was a champion for, and we wanted to make sure that our efforts to support social value must be ethical and social in terms of our processes, the way that we do it, our approach, as well as the outcome. So that's really important, to make sure that we embed social value principles, ethical practice across the whole of the social value process. And it's about making sure that we're inclusive in our approach to social value. Social value is for everybody. Next slide, please. So just to give you a couple of examples from Cheshire East Council and some of the work that we have developed locally. And some of these, so if you look at our learning disabilities and mental health partnership boards, we have carers forums, we have a number of mechanisms to enable us to have those conversations with people when we want to co-design, co-produce, co-evaluate, co-deliver services. It's important to make sure you have those connections and have those mechanisms. I'm sure your organisations will have similar ways of having those conversations, but also it's important to take those conversations out to wider communities as well, which is why we developed and co-produced with our communities our Live Well for Longer plan, which was about co-producing with our communities the way that they want to work with us as a local authority. And part of that was the co-design of what we have in Cheshire East, which is our Together Guide, which is an agreement with our communities and residents in terms of the way that we want to work with each other. So our residents, our communities, children and young people told us how they wanted to work with the local council, how they wanted to make sure that they're embedded and involved and have a voice in co-designing, co-developing and co-delivering services locally. And we came up with a number of key mechanisms. So we are Cheshire East as our local volunteer forum and network, and we also have developed some crowdfunding mechanisms as well, so that we can co-design and co-fund some of those key priorities that local people recognise within our communities as well. Next slide, please. For me, working within a local authority, we have a commissioning framework that we work towards, and my team worked towards this framework, and it was really important that we embedded social value and co-production across the whole of that commissioning cycle. So just to give a couple of examples, when you start within the commissioning cycle, when we're analysing, it's about thinking about social value and co-production from the beginning. Knowing your customers isn't just about the data, it's about the conversations and the co-production approach that you take in terms of working with residents and communities, in terms of understanding their experiences and their needs and what outcomes we need to be co-producing and delivering together. When we're planning services, it's about co-designing those outcomes, so going back to the recipe for a good life, understanding what those priority outcomes look like and need to be and should be with our residents and our communities, what that looks like, so co-designing with suppliers, with the market, with service users and communities when we're co-designing our service specifications, for example. And also, another example would be when we're reviewing our services, it's how we embed individuals, communities, service users in the evaluation process with our contracts, how we co-deliver services. But also it's important to make sure that through a tender process that we are co-designing those tender questions with individuals, and also involvement in tender evaluation panels, presentations, for example. Last slide, please. And really just wanted to plug our Social Value Award. And again, the common theme that I think I've spoken about today is that co-production has been embedded in terms of everything that we do. So our Social Value Award that we co-designed across Cheshire and Merseyside, we've adopted within Cheshire East Council as a tool and a mechanism for maximising social value, but also just to highlight that our Social Value Award was also co-produced and co-designed with the voluntary community face sector, with business and industry, with public sector as well. So I think the key message for me today is to make sure that you embed co-production across everything that you do if you want to maximise and achieve social value. And that's it from me. Thank you.
Shelley, I just wondered if I could, before we hand over to Mark, and just to pick up this, if you can look back, let's say, over the last year or so, and your really strong message on co-production throughout that presentation, what would be the most memorable, impactful thing that came that you didn't anticipate, but actually was quite innovative, changed a service in a different way than you thought, or made a big impact in the way that you might have delivered that service or solution? Could you think of a couple of examples that as a result of that co-production, it changed something quite significantly?
Not one individual, there's so many, and I'm really fortunate that my team do really live and breathe co-production. I think, so when we were recommissioning our substance misuse service, for example, I think one of the biggest and most impactful experiences that I had was when we were co-designing our service specification. That service specification, we did a process of service user journey mapping where we had we literally visited all of the peer groups and peer network sessions where we had conversations with service users about how their experience of their current service felt, what difference they wanted to see and achieve through a recommissioning process. That influenced our service specification, and I think when we did the tender evaluation process, we had a room full of service users who were presented to via the bidders for the tender, and there was lots of really insightful and important questions that came out of that tender process from people with lived experience who use that service, which obviously ultimately those individuals shaped what the service looked like and then had a say in who was successful in being awarded that contract ultimately. And we had a group of over 50 service users who were really, really keen to be involved in that tender evaluation process, which was really important. And for me, the main point of that and the feedback that we had was that they felt that they had a voice and they were able to influence what that service looks like moving forward. We did a bit of a follow-up as well and went back to those individuals to say, has that made a difference? Has it had an impact on the way that that service has been delivered? And we have had some really positive feedback from that as well.
That's a really good example, I think, Shelley, and I recognise that in, you know, is a really important example. So thank you very much. Let's now move on and introduce the Chief Exec of Wellbeing Enterprise, which is Mark Swift, who, if you have a look at his LinkedIn, describes himself as a serial entrepreneur. I think that's possibly the right description. I don't know, but over to you, Mark.
Thank you very much, and hello everyone. Thank you so much for that introduction, Alison. It's both a pleasure and a privilege to be here today to talk to you about the learning journey that we've been on across Cheshire and Merseyside as we start to unpack social value. I'm here to talk about 3 key points, if you like. The first, building on the work that Shelley has been leading on, about the role of co-development, co-delivery, involving citizens in shaping the social value and anchor institution work streams that we developed and what we've learned from that. If nothing else, I think what we've realised is by involving communities, we get a much richer diversity of views and opinions, we create community ownership, and actually we build the sort of movement that is required now to tackle the complex, wicked social challenges that are impacting on our community. So nothing about communities without communities. And I think social value gives us an opportunity to reimagine the ways that we deliver work. So I'd like to touch on that. Secondly, the role of the voluntary community social enterprise sector and the role it plays. The long-standing role it's played in developing social value. Of course, that contribution goes way beyond the development and implementation of the Social Value Act, and indeed the creation of many of our anchor institutions, including the NHS. The contribution of the VCFSE sector has been here for many, many, many years, hundreds of years, in fact. But of course, that contribution is also facing pressures too. And I would like to argue back my pitch and proposition today is that if we're serious about social value, one of our core priorities should be that we focus on ensuring our voluntary community social enterprise sector is resilient and robust enough to survive and continue its legacy long into the future as well. Next slide, please. Just a little bit about us. So I'm with Wellbeing Enterprises. I set Wellbeing Enterprises up 18 years ago. We were one of the first community.
We've just lost your sound there, actually. I don't know what's. Oops, there you're back.
I think I've just was muted then, but I'm back. So I don't know where I was up to, but for we set up the company 18 years ago. We're a values-led social enterprise, and our purpose, our mission, is to help people live happier, healthier, longer lives. And we do that by working with communities at the grassroots, understanding what it means to live a valued and dignified life, and working together to co-design and implement solutions that help to build people's wellbeing longer term. And we were approached by NHS Cheshire and Merseyside to help them fulfil their obligations around social value by ensuring that the community and wider stakeholders play an active part in shaping the work streams that we're developing. And I'm going to talk a bit more about that now. Next slide, please. So what does this involve? Well, it's involved us rolling up our sleeves and actually working at the grassroots. And I think that's been the most exciting aspect of developing our social value endeavours, if you like. This is a bottom-up grassroots approach as well as a top-down way of working. That pincer movement, I argue, gives us much more insight and much more of a focal lens to target our work in terms of tackling health inequalities. We've engaged around 320 citizens so far and diverse cross-sectoral professionals in a range of focus group discussions and online surveys where we're centered the question around what social value means to people in the context of their lives, because we have to ask, who is this about? This ultimately is about the social value of our communities, and our anchor institutions exist for that very reason. So what priorities matter to people in relation to social value? And also, how might we go about measuring the success and attainment of those values? And of course, this work has helped to inform the key priorities that are now driving our work in Cheshire and Merseyside, which are on the next slide, please. So of course we've got key priorities like ensuring that our anchor institutions pay the real living wage for their workforce, or that we tackle environmental impact and achieve net zero before 2040 or sooner, that we tackle health inequalities. But of course this work is much more than just KPIs, key performance indicators. There are other KPIs, such as keeping people involved, keeping people engaged, keeping people inspired and informed. And that's absolutely critical too. And I would argue that we can't achieve these objectives unless we work together as a community and we mobilise the social capital, the glue that holds all of our institutions and communities together. Next slide, please. So if we look at the insights that we've garnered so far from our sort of consultative work, we've built a repository of insights, both strategic insights and very practical, pragmatic solutions that we think can help us as well as we push forward with our social value endeavours. I think the first key message is that nothing about communities without communities. I think we're in a very different time and space now in society. People want to be active agents for change. Purpose really matters to people, and people want to have more power and more right to make decisions about how public resources are spent. So I'm really keen, a challenge back to the system here is about how we can devolve power back to citizens, and I'm particularly interested in ideas like participatory commissioning and participatory budgeting, where citizens play an active role deciding how resources are allocated. Really, really important. We're also seeing, for example, the emergence of broad-based civic networks like Liverpool Citizens, where citizens organise into groups and champion the causes and issues that matter most to them. Our social value endeavours must be aligned with what the community tells us they want and need to live a valued and dignified life. And in Cheshire and Merseyside, there is a strategic commitment to ensure that continues now and well into the future. Talking to our cross-sectoral partners, they're talking extensively about this desire around building relationships. This is a complex endeavour we set out to do to both tackle health inequalities, improve environmental outcomes, and we can't get there on our own working our individual institutional silos. So there was much conversation, particularly amongst the voluntary sector, around this idea of creating porous boundaries between organisations so that knowledge and information can flow freely, and that way we can then create more innovations and new insights as well. Diversity of insights and perspective is absolutely critical if we are to engage in a social innovation process, as Shelley mentioned earlier in her presentation. And then finally, a point from the voluntary community faith and social enterprise sector, which came out very strong indeed. This idea that we have to avoid a race to the bottom. There is now, of course, an expectation that the VCFSE sector will step up and become a mainstay provider of many public sector services, as it has done historically, working with our NHS colleagues. But for that to happen well, and for us to meet demand, we need to ensure that our contractual values match the workload that's required. For example, the voluntary community social enterprise sector also wants to be able to fulfill its social value objectives too, including paying its staff the real living wage as well. But if we're not careful, if our contractual envelopes don't match the task and the ask, there is a danger that we pass wage inequality down the supply chain, so that the only people who are able to afford a real living wage are anchor institutions and not those who benefit from the supply chain provided by them as well. Next slide, please. And so what of the voluntary community social enterprise sector? Well, I think it's an exciting opportunity. We have over 250,000 active voluntary community social enterprise organisations operating across the UK right now. And what's most exciting is 3/4 of those are delivering public services directly in the communities that they serve. So they're rooted in their communities. They're engaging in participatory and inclusive methods, co-designing and co-developing new ways forward, and involving communities, not just as the recipients of services, but also as their delivery agents as well. And I think that's absolutely critical to building the sort of social movement and change that's necessary to tackle health inequalities long and into the future. Next slide, please. So I suppose looking at some practical and pragmatic things that we can do from a social value point of view, we need to come to the procurement side of this, where the Social Value Act, of course, originally had its first views and say. And the first point that was very clear is that grant funding is absolutely critical to the voluntary community social enterprise sector. Let's not forget that for many VCFSE organisations, this is the first step towards procurement. And indeed, there are many barriers for the voluntary sector being able to engage in procurement exercises. In fact, only really often the larger VCFSE organisations or national ones actually are actively engaged in government procurement for funding. There can be real disadvantages around structural capacity or experience with bid writing. And so it is important that when commissioners put work out to tender, that the ask, the amount of work or the sunk cost that the VCFSE organisation is expected to commit should really be proportionate to the size of the contract envelope and the complexity of the commission being asked. It wouldn't be right to have a one-size-fits-all process for procurement, whereby acute hospital trusts who are applying for hundreds of millions of pounds of funding are following the same process that a smaller VCFSE sector would for a smaller commission as well. The workload needs to be proportionate. Also, the sector made it clear that it's often difficult to become aware of opportunities for commissioning and tendering, and actually that the sector would benefit a great deal from partnership opportunities as well, where collaborations of voluntary sector organisations can come together and bid for work. And then finally, just this point again around making sure that the contracts are resourced appropriately, because if we're serious about social value, it's about ensuring the whole supply chain can contribute. And obviously, when we look at the voluntary community social enterprise sector, those organisations will recruit people from their local areas. And therefore, if the contract envelope is not sufficient to enable those organisations to pay their workforce the real living wage, then we do create wage inequality through the supply chain, which is something we must be very careful of, that we avoid that at all costs. So moving to my final slide, just in summary really of the sort of learning journey that we've been on, I think it's fair to say that we have so much more to gain by involving our communities and citizens in the co-creation and co-development of our social value and anchor institution endeavours. And what I'm taking away is this repository of information and knowledge and expertise and energy for change that wants to be mobilised in communities. And I think actually by doing that, by involving citizens, we create the shared ownership and build the social movement that's necessary to tackle these wicked social problems that challenge us. Here in Cheshire and Merseyside, working with NHS Cheshire and Merseyside, there is an ongoing commitment now to continue this co-development journey, and I'm currently supporting Becky, Dave and Shelley as we look to recruit some citizens representatives to join our new Anchor Assembly while we continue to unpack our social value work and engage in this co-development approach. Devolving decision making to citizens is absolutely critical, and where we can, we should push for that through things like participatory budgeting and commissioning. And then finally, let's not throw the baby out with the bathwater. Our voluntary community faith and social enterprise sector has been here for hundreds of years, championing social value way before the legislation came out, and indeed way before many of our anchor institutions that we value and treasure here now. There is a risk, however, that if we do not make this our overarching priority, that we want a thriving social enterprise sector, we're at risk of losing that, or worse still, undermining the contributions and efforts that they make. And why does it matter? Why does it matter that we invest in our VCFSE sector? Well, if we think about it, as we said, those organisations are rooted in our communities, and what they really represent is an opportunity to deliver services directly on the ground in an inclusive and participatory way. But those employees, those owners of those organisations, are themselves activated citizens. They are also the agents for change in our social value endeavour as well, and therefore we need to give them all the support that we possibly can to ensure that this work can continue now and long into the future. Thank you very much for your time. Thank you.
Thank you very much, Mark. What occurred to me as you were saying, you've got some real practical steps there about how to support the voluntary social enterprise sector, faith social enterprise sector. What would you say is the biggest challenge if we continue to use a tendering approach as opposed to what you're talking about, which is investing in shared assets and knowledge and expertise to mobilise that sector? And how do you get that balance right, where you will have to have skills and expertise in applying for grants or going through a procurement, and that does give quite a barrier to small voluntary sector enterprises, doesn't it? Versus, and there is this, as you say, you know, the uppermost objective should be about trying to get these to be thriving. So how do you balance those two things, or what's your advice in balancing those approaches?
Yeah, thank you for that, Alison. It is a challenge, isn't it? Because of course, VCFSE organisations will be at various stages of their own developmental journeys. You will have grassroots organisations, or myself 18 years ago, I was an individual who was passionate, who had an idea for social change. And for those individuals on the ground, it's about the seed funding, access to training, knowledge and support and encouragement that we can give, that anchor institution professionals and others can give to ensure that we build that ecosystem support in the community. Now, I think procurement is not the route to that. Grant opportunities, those sorts of opportunities are absolutely critical. In fact, my organisation itself has run our own programmes at Be the Change, where we give £500 grants for people who have ideas for social change, and you will be surprised to what extent these activated citizens can sweat that resource to deliver the kinds of outcomes that are essential for our community. So for me, there's that bottom-up incubation period where we're giving knowledge, support and seed funding, and then as organisations develop and grow, it's all the additional infrastructure support that can be provided to ensure they have the appropriate policies and expertise, and then beyond that, grant funding within anchor institutions, moving towards procurement. But I do worry that the procurement process itself feels to me like a one-size-fits-all process, and there is more work to be done to ensure that the procurement process and the ask within each individual procurement exercise is proportionate to the contract value and the complexity of the commission, because actually these pieces of work, they're 20,000 word exercises, incredibly complex, and I would argue often fail to really pick up the nuances and the real value that the VCFSE sector can bring. So I think we need a more bespoke and tailored approach to procurement longer term to avoid some of these sort of obstacles and barriers which will ultimately impact on our sector. So grassroots, top up, and recognising that the sector is in its own development cycle. We need to be able to offer investment support, knowledge and goodwill at all stages of that development journey.
Thank you, brilliant. Thank you very much, Mark. So I think we're moving on swiftly, as they say. So my next speaker is Dave Sweeney, who's Director of Partnerships from Cheshire and Merseyside ICS, and really looking forward to Dave's inspiring presentation today. Thank you, Dave.
Thanks for the kind words. I hope I can live up to that, Alison. Yeah, so I'm Dave Sweeney. I'm the Associate Director for Partnerships and Sustainability, which I'm really proud of, because that means that I work with what I class as the left side of the NHS, and it's a really important side of the NHS. But it's only really come to fore over the last few years or so, and indeed I kind of built this portfolio myself, and I recognised to my boss at the time that I just said, look, you're going to need some leadership around this, because it's the kind of things that bite you on the backside if you're not doing it. And since that time, through that portfolio has been built, a lot of things have become a legal entity, legal requirements in terms of reporting back, net zero, social value in itself, the Anchor Institute work. It's a massive task and a massive ask, and it's really different for the NHS. It's really different. And one of the things that I've done through my leadership, if you like, as the SRO, so the Senior Responsible Officer for this area, is to remind colleagues and remind partners that this is about bringing the NHS to the party. So for those colleagues who work in local authorities, you've been doing this for a long time. Those people who work in private sector or the voluntary sector certainly have understood what social value means, because it's a core component of your business and your success in terms of your business. So we are bringing the NHS, that party. Environmentally, the NHS is a 4% polluter. You know, you'll have all seen David Attenborough and shed a tear like I did when, you know, the Our Planet documentary, and it's just massive. So I think there's in that again, from a leadership perspective, and gaining that ground and gaining that fellowship, it's extremely vogue and it's extremely morally important that we do this kind of work. So if you think about the new changes, you think about the emergence of integrated care systems, integrated care partnerships, and you're looking for some integration. You're looking in your own place or your own system to gain some leadership and gain some fellowship. Social value and the elements of social value is a simple and really clever way of brokering that. Because if you're asking the question in terms of how can we produce added value, how can we do more, what is it we can do from both an NHS statutory organisation, voluntary sector, private sector, to bring more into our communities, then this is the way forward. And what we found in Cheshire Merseyside has been there's been a huge amount of passion around this. And my tip, as I said to colleagues earlier, is don't waste your time with tire kickers. Don't waste your time with mood hoovers and, you know, dementors. Work with the passionate people, work with the people who want to make the change. And those individuals who are kicking the tires and are kind of complaining about duplication and various other things will come along at some stage. It's morally sound. It's morally absolutely the right thing to do. So things like putting your money where your mouth is, because Mark, I've worked with Mark a long time, and he always reminds me to put your money where your mouth is. So this enables me to have conversations at the highest level to talk about 3+ 2 year contracts in the voluntary sector. So as an NHS employer, an NHS contractor, putting year-on-year contracts out to the voluntary sector is not economically sound, especially when at Christmas those small organisations are putting their staff at risk at Christmas time because they don't know if they got a contract in March. It's ridiculous. It's unsound. It's socially and economically at odds with everything we're trying to do. So the policy around social value and the work around social value brings together people and organisations that want a different conversation, that have a different conversation. Social value isn't going to change the world, and I loved Alastair's passion about, you know, in his presentation, in terms of he's kind of dedicated his life to this, and I love it. But when you tap into that integration, when you tap into those individuals who want to make a difference, so you can see the path to a different way of working, it becomes a much more simple exercise. So my job now, and especially through the support of Becky and the team, we brought all our procurement teams together across all the trusts. And these are individuals that have been banging on a door for years and years and years without really a voice. It's almost like they're stuck in some kind of dungeon with a computer just to work on these lengthy, you know, procrastination around £20,000 referrals, and then going through a mechanism that makes no difference to anybody at all. And now they're out with kind of freedom into this group of people who are all looking at the same things. So we're now having discussions about energy, not just in one place, because we're in Cheshire Merseyside, we're a big ICS. We've got 9 places. We're now having discussions about energy across system. And I wrote this morning to Andrew Ferber, you know, nationally, are we wasting our time here? Is this something we should be doing? Is this something that we can do nationally? So we're having influence on a national level, because we're having those conversations. So we're working on a 15% weighting in social value. Now, here's an interesting thing. When you invite the private sector into that discussion, and again, we've been really nervous about that from an NHS perspective. Who can we work with? Who can we work with? But with social value, there's no conflict in that. What people want to understand is what they can do, how they can get back, how they can give back. So we're working with some big private organisations to say, well, what about if you did this? So we work with an organisation who was doing sort of reducing paper around printers. Very simple project, and it gained a huge amount of support. What they did was then, as part of that commission, as part of what they did, they're going to plant 1,000 trees in Cheshire Merseyside. And it seems really simple. It seems really simple that. Then you link that with your public health debate. You link that with respiratory and green spaces. You know, you link that with open spaces around obesity and kids having the ability to, you know, be less sedentary and get out and do sports and play, you know, play in parks and stuff like that. The knock-on effect is massive. So I'm going to leave you now, and I'm going to leave you with a few tips, which is, if you want to impress and you want to open some doors, social value is a door that's open and it's pushable, and you have the right conversations, get the right people in the room. Start from the bottom, have a discussion in your communities about what your communities are looking at, what your places are looking at. Wrap around social value in that, and you've got a mechanism to have a discussion right at the top of the tree. I'm nowhere near at the top of the tree, but I've got so much evidence and backing and a brilliant team behind me now that they can't ignore us. And it's one of the things we've been nominated for HSJ awards now, and that doesn't really matter. The difference is what difference we can make in our communities, and that can be vast and it can be huge. And I just urge everyone to get into this zone, because the NHS will not survive on ambulances and medical systems. We're really, really good at fixing people, really good. And I think COVID has set us some huge, huge challenges. It is not a sustainable model if we don't look at the other determinants of health and the wider determinants of health. And in Cheshire Merseyside, if you don't pay the living wage, you don't sign up to the social value charter, if you can't provide us assurance that you're looking at prevention, you will not be an Anchor Institute. If you can do all those things, we'll welcome you open arms, and then we'll work together, not on performance management, on assisting each other into the journey where we finally become far more sustainable. And some of our families in our more deprived areas perhaps will be able to go on holiday and enjoy a happier Christmas, more flourishing lives. Those kind of things I want to measure, not just the kind of the more clunky, sophisticated performance measures. So I'm going to leave you there, Alison.
That was brilliant. Thank you, Dave. And I love your, I've got this picture in my brain really of people being freed, really enabling and freeing people to really innovate. And we've talked about social innovation right through the presentations. It's something that I think is just so exciting, that there's still a huge amount of energy, commitment to public service and to make a difference to people's lives. I think we just need to enable, free that up. And I think in the chat people are saying, what about NHS rules? We need to find those people who are really committed to making this happen, don't we, really? So I think this is great. And I genuinely do think this is about creating the NHS of the future and public services of the future. It's a very, very timely and much needed reimagining of what public services are, really, in partnership with our communities. So very, very much support your comments there. And there's lots of comments just for our speakers. There's quite a few questions in the chat bar, so if you can spend a moment just having a wee look through those, because I think people are really keen to hear your thoughts back on the questions that are in the chat bar. So if you do quick click on reply, you should be able to comment on that. So let me hand over to our lead in AGEM, and she's made a massive difference in the short time that she's been with us, Becky Jones, and she's going to talk a little bit about the offer that we can make, the joining together that we can do between us all to create this really exciting social value network. So over to you, Becky.
Thank you, Alison. Can I have my first slide, please? And the next one, please. Thank you. So I wanted to really start this off today just by saying, why does social value matter? And I think it's already been spelled out. It's already been explained by everybody who, I'm really lucky I get to work with everybody on this call and, just be really learn and just to be involved in all of this great work that's taking place is really, really exciting. And I think, working with Dave, when we talk about stuff and, sometimes I'll just go on and on and on. Dave, bless him, he just listens and he's always really good. And he'll just say, Becky, we need to know the so what. What is the so what about what we're doing? And I think this is what we need to do in order to get to the heart of what we're doing. Social value, so what? Well, I think we've gone through it today. We've got legal responsibilities. We have to do this. But more so than that, we've got moral responsibilities. This is the right thing to do. And I think we all know that on this call. That's why we're here. But it's not easy, because if it was, we wouldn't be here. We'd be off doing something else. And it's really, really complex and complicated. We've got all these different priorities that we need to do. There's lots of mixed messages and we need to do this and we need to do that. And we know we need to do something, but what do we do? And I think the easiest thing to do is strip all that away, take away all the theory and the this, that and the others. All we're doing is putting people at the heart of all that we do so that we can say, when we do the X, Y and Z, we're going to get the maximum input and the maximum output for the local people for whom we serve. And it's as simple as that, really. Next slide, please. So how do we do that then? So what we need is a consistent framework where we can all work together to have our own sort of defined outcomes that we can deliver, but in our own bespoke ways, working with our local communities, working with our local organisations. We as public servants have a responsibility to do that, and we need to have a simple process. And I'm kind of quite a simple person, and I kind of view things in boxes. And if you have a picture, that picture's broken into lots of different pieces, and each of those different pieces have to come together to make that picture. And at the moment, we've got lots of different jigsaw pieces, but we don't necessarily have the overarching picture that we need to put those pieces together to fix. Next slide, please. And the reason why I think we have all these different issues is just because there isn't a framework. There's nowhere we can go to find something. Like Mark was talking about the funding. We need funding. We've got the commitments, but we don't have the funding to do it. And, people talk about the NHS. There is no one NHS. There's lots of different organisations who are all under the same badge, but don't really work together very well. We see, instead of working together, we see cooperation as competition. It's very much we'll sit there, like you're in school, just covering my homework, don't look at what I'm doing. We need to just break away from that way of working. We need to have this consistent way of working together, because what we have is all these competing priorities, the deadlines never move. The priorities keep building up and up and up. People's workload builds up and up and up. And people who tend to work in this area, it tends to be an add-on. So something else, because you've shown an interest in something, it's something else which you have to do. And the up and up and up and up, the deadlines and the pressures. And so there's nowhere we can go to say, well, how can we do this? Well, I know I need to do this, but where can I go? And I don't want to ask them because then they might pinch my ideas. And it's just this kind of like a huge black hole that we're kind of spinning around at the moment. And that means that we often end up just spending tens, hundreds of thousands of pounds on consultancy, and not the kind of work that we do with our local communities, with our voluntary sector, but just on big consultancies that just come along and copy and paste. And then it's like, well, good, we've done that, we've hit that deadline. But I'm working at the moment on looking at analysing all of the green plans that were written. So all of the trust green plans, all of the ICS green plans, and we're looking for trends, we're looking for, gaps and things that we can do moving forward. And one of the things that just comes right out and hits you right between the eyes is those organisations that have written their own plans, those organisations that have worked with their local organisations, and those organisations that have just gone with a big, massive consultancy company that have just copied and pasted things across. And I think what we need to do when we're sending that out, we're sending out our skills, we're sending out our money, we're sending out our opportunities, we're selling out our local communities. And in the grand scheme of things, we're selling out our planet, because we need to do this properly. We need to do it once and we need to do it properly. And there is nowhere to go to do that until today. Next slide, please. So we are launching the Social Value Network, and the Social Value Network is going to be a place that is going to be for the public sector, on behalf of the public sector, where we can get all organisations to come together and add in. So Arden and Jem are hosting this, but this is something which is going to be owned by you guys who are here, by all the organisations across the public sector. This is sort of a new day. It's like a birth of something really, really exciting that we're launching today. Next slide, please. So what is this? So first of all, this is not for profit. This is something that Arden and Jem have invested time and money in, but this is something that we are launching at the very start to say, what do you want? What does a network look like to you? How can we get maximum impact? By having everybody to come together, I was talking about my pictures and my pieces. This is all of the pieces that can come together to build this picture. We need to keep the skills and the knowledge into the public sector. We need to train people up. We've got people coming to university, they're doing these kind of things at university. There's nowhere really for them to go. Let's help give a funnel, give a framework of places for people to come and learn and grow and develop social value into the sector. It gives maximum impact for our colleagues. It gives maximum outputs for our local communities, for our customers, for our patients, for everybody. And by having this one place for people to go to, you don't have to scratch around looking, where can I go? How can I get this? Because it's here and it's designed to be developed by everybody. Next slide, please. So what exactly will this network be? So in the first instance, what it's going to be is to work with an organisation to say, what does social value mean to you? So it will be to help define social value for each organisation. And once we've got that, they'll be carrying out a baseline to understand where are you, where's the gaps, and then to build and develop a bespoke approach for each organisation to deliver social value. In time, we've talked about place and the importance of place. In time, it'll be, ideal to have an ICS signed up with place priorities to deliver and an overarching social value definition. And there are so many opportunities to do this. And there's a payment process. And again, we want people to come and work with us to define what that is. Because we need to have this as a paid option, because if you don't put a value to something, then it's worthless, and this isn't worthless. We need to do this, we need to grow this, we need to have this as an option and an opportunity for all colleagues across the public sector to be able to access, so we can develop this tool and make sure that social value is in everything that we've talked about today. We've also got a social value advisory board. So everybody who's speaking today, plus some other colleagues from across public, private and voluntary sector organisations, are all on this board. And they're there to give their guidance and their support and their advice to help people, through thought pieces, through strategic thinking, to help people to take this forwards as we move on through the social value journey. Next slide, please. Thank you. So what this is going to do is this network is going to provide an opportunity for all sorts of information to be added onto it. So social value focused, social value content. We want to be working with people to create this, to develop this, to put this all into one place. And like I say, we can then grow people. So we can work with your organisations, but you can then upskill people in your organisation. So that skill is within your organisation. It then sits across every department of your organisation. So you can make sure, are you working with your procurement teams? Are you having the conversation about the issues that Mark raised about it's all well and good paying a public sector organisation a real living wage, but what about the impact then on voluntary sector organisations? That is not right. And we need people in those positions to have those conversations. And that is what this will do. It will give you the opportunity to have those skills, to have that knowledge, to ask those questions, to shine a mirror on yourselves and say, are we doing what we need to be doing? Not just because we need to from a legislative perspective, but because it's the right thing to do. And in time, we're going to be developing different awards. So all of the hard work that's put in, you can say, look, we've done all of this and now we've achieved this. And that's great. But now let's move on to the next one, because if we're not moving forwards, we're going backwards. And from Cheshire Merseyside perspective, you know, as has been said, you're constantly moving, constantly raising the bar. It's not good enough to stay here. We need to be here. And that's what we need to do across everybody, across, you know, NHS in particular, because as Dave says, but, you know, the NHS is coming to the party, or, you know, local government, other places have been doing this for quite some time. So we need to get stronger so we can challenge and we can set the bar ourselves. We can make this happen. If we work together, all of those pieces, we will have that picture, and the picture will be the social value network. And it is possible to make this happen. Next slide, please. So what we've got then, we've got, and I'll put this in the chat later on, we've got this free to access for everybody workspace. So if you're on Futures, you can just click onto this, and like I say, we'll send this out afterwards, and I'll put it in the chat as well. And this is a free for everybody to access place to go to access things on social value. So everything that's already free out there. So the stuff that Alastair talked about before, we've got information on there that links to free resource from social value. We'll start to put blogs on here. We'll start to put bits of information. We'll put this recording on here as well. We'll start to develop case studies. So this is something that everybody can access in order to say, where do I go in terms of social value? And this is a free place for people to access. And like I say, you can have a look on it today. We'll start to develop it, and we'll put free resources on there. And this is just somewhere to go. But just to do, where do we start? Well, this is where we start. Next slide, please. And so just talking about the Social Value Advisory Board, these are the people, so say you'll recognise most of these people who've been speaking today, but there are others. And let's grow it. You know, let's bring in more people to be on this board. Let's get different thoughts and ideas so we can really develop and start to really make a difference across all the different areas which we need to in order to have a long-term difference. Next slide, please. And then what we've got here, this is what's going to be a part of the paid membership. So you're going to be able to access onto the front page, and then there'll be a section for people who pay to access. And on here, this is where you're going to be able to have all of the support that you need. So we can come and work with you, like I say, to do the gap analysis. And then it's building all the different documentation. You know, where are you in terms of your social value policies, your strategies? Have you got those links with the local communities? Have you got those links with the voluntary sector? We'll be able to develop some training. We'll have a community of practice. There'll be more in-depth opportunities to speak to the board. There'll be webinars. There'll be all sorts of things to help you grow and develop your specific approach to social value, and to making sure that we've got social value and anchors and reducing health inequalities and all the things that we need to be delivering on. This will help you to develop your own bespoke approach. Now we've got a session on the 5th of April at 9:30. So if people want to come and join and become an early adopter and help us to develop what this looks like, and help us to say, we think social value is this, we need this, we need this, please drop us a message. You can come and be involved in this. This is your network. This is something that we need to create together. So please, let's do this on the 5th of April. Just drop a note, and then this is all of the kind of things we can start to do. And then you can say, we want this, we want this. Fine. Chuck it in. Let's make this work. Let's make this for everybody to access. Next one, please. Thank you. So what next? Join us. Come and be a part of this network. This is for all of us to take a part in. Everybody has a voice. Everybody has a right for their voice to be heard. And this is a network for people to come and be involved in this. We can help you to develop your bespoke approach. You can then develop and influence how things happen across your place, across your area, across the country. You know, this should be something that we should be doing together as one, through one network, bespoke for our local communities, but all working in the same way. So I think this is something that's really exciting, really a great opportunity to witness kind of the birth of something like this. So please do, if you can go into the next slide, please, drop us a line. The email address should be there. I'll put the links in the chat as well, so you can access the free page. And thank you very much. If I could just get the next slide up with the email so people can access, that would be great. Thank you very much.
Thank you. That's brilliant, Becky. And again, throughout this presentation, you've tied it up really nicely, because you've again talked about co-production. You know, we want to do it with you, not to you. You know, it really is about, you know, it's a genuine network, and a generous network of generous sharing of knowledge. And the front end of this is completely, you know, as much knowledge as possible on that Futures website. And if you could spend a minute popping the link in the chat bar, that'd be really great, because people want to already asking to get on there and start to delve into that. So that would be fabulous. And then as you start to understand the needs, there's lots of expertise and support there. And it is absolutely not for profit. This is about a genuine opportunity for us to give back. And the NHS is a fabulous place to work, and public and the wider public service and involuntary services. There's so much knowledge and generosity out there. People do want to share the knowledge, do want to make a difference. It's about how you do it. So this is the way of us doing it. We're creating infrastructure so we can do that. I'm a great believer in adapt and adopt, which is quite a posh way of saying pinch with pride, really. So we're very much into that here, which is adapt, adopt, fast track as much as possible. So please, if you've got any more questions, we've had a few. I think we've been answering them as we've gone along, actually, and I've been trying to pose your questions to the speakers. I guess the one for Becky would be, what would you anticipate the most useful support that you could offer individuals at this stage? Really, you've already set up the website, but beyond that, what would you say?
I think for me, it's having those initial conversations to try and understand, where is an organisation now? Where do they want to be? And how can you articulate that into a social value process that aligns with all of the different regulatory processes that you have to go through? So it's not something separate, but it's just to understand, what do you believe? What's your values? How do you see those living out in the work that you do? How do you see yourself delivering on them? Then you're defining your social value for the organisation, and then helping to put in place the different policies and practices that are going to need to be put in place to allow that to happen. So that's what I think the first thing will be, and just to have those conversations, because people will have all sorts of things that they want to get across, and it's kind of pulling all of that together and replaying that back in a process which is actually achievable and then measurable as well. So that's what I think, is just to get all of the stuff together, put it back together and build it so it makes sense and it can be delivered on.
Fantastic, thank you. Just a final opportunity before we wrap up. We will absolutely put the recording onto our NHS Futures site, and we'll make sure that that is all available with all the materials and the slides you can reuse if you want to reuse in your local presentations. Just a final opportunity for any member of the panel would like to make any final comments. You're very open, welcome to do so.
I'd just like to thank everybody's support. I'd thank Alastair for his support, and Alison and you and your team. And just to kind of build on what Becky's said, because when I sit in, I've just been listening to my colleagues who I work with every day. I still the hairs on the back of my neck stand up. You know, because of that passion. There was a question in earlier around, a really difficult question, you know, where are these passionate people? and it's a really difficult one. It's a really difficult one. But again, just to wrap up, the policy, social value as a policy, as a standalone policy, will make no difference. As a community of practice and a way of working, it can make a massive difference, not just in the community, but in terms of your own work, in terms of enjoying what you do, in terms of enjoying your job, enjoying the fact that you're getting up in the morning and you feel like you're making a difference. I think COVID and a lot of things and a lot of the change and the restructure and all that kind of thing has stripped the enjoyment out of work. And you know, getting up for work shouldn't be a burden. It should be something you enjoy. And I think so. It's for us all to kind of think about that. I think, well, you spend a lot of your life working, and you know, and if it's something, you know, if it's something you can get involved in and enjoy and feel part of something else, as Becky's just said, it'll make a massive difference. It'll make a massive difference, and you'll enjoy your wine on a Friday night much more. I guarantee you.
Thank you. That's great. Thanks, Dave. Really appreciate it. So we'll wrap up there. Thank you for everyone who's attended. We know some people haven't been able to attend for technical reasons, so hence we've got the recording, and we will certainly send that back out to everyone who's expressed interest. So, and please get involved. Thank you again. We'll close the session now.